Good afternoon, everybody. Congratulations on getting through the first module of the research curriculum. By now, you should have developed two different research questions, one that'll work better in the clinical setting and one that would be better for a literature review, a scoping review, or a systematic review. Today, we're going to talk about how to take that clinical research question and change that into a research protocol and/or how to design a research project. So the goal of our lecture today is to understand the key components of a research protocol, describe key components of research protocol methodology, and learn about how to construct a Gantt chart to keep us on track in terms of time throughout the rest of this course. Today we'll talk about what a research protocol is, talk about the key components of a research protocol, we'll introduce different types of data, which will be important to designing your study, and we'll talk about different ethical considerations, and we'll discuss how to write an IRB proposal in another lecture. So just for some background, a research protocol is a document that outlines the planning of your study. The plan must be designed to answer the research question, but also provide a detailed description of the objectives, design, methodology, and statistics used. In short, the protocol is essentially a cookbook for conducting your study. And your research protocol will also be the most important document in your application with your institution's review board or ethical approval board. When we think about what is used for a research protocol, there's usually a pretty consistent template for what should be included. You'll need a title for your research project. You'll need to include keywords, a background of what your research is and why it's important. You'll need to very clearly describe what methods you're going to use to perform your research study and what ethical considerations you'll be making during your research project. In addition, it's very helpful to include a timeline in your research proposal so everyone who sees it knows how long the study is going to take. A good protocol does not duplicate prior work. It should be new. It meets ethical approval. It answers your research question. And it's feasible to do in the time frame you've allotted yourself. In addition, a protocol really clearly outlines the data analysis before the study begins, and the study is affordable to do. Now, as we go through the rest of the PowerPoint, we're going to look at examples of the different sections of a research protocol. So first, we think about the keywords. These are 5 or 6 keywords that you think define your research project. These are often the similar or the same words you used in your literature search. So for example, when we think back to the study or the question looking at what affects outcomes for patients with duodenal atresia who receive surgery in Haiti, some of the keywords we can use are Haiti, prognosis, duodenal atresia, surgery, and pediatric. Next, you want to think about the title of your research project. You can use your keywords to write a title for your research protocol. These titles should be concise and give the reviewer a general sense of what you are investigating. So when we think about the research question, looking at what affects mortality for patients receiving a surgery for duodenal or intestinal atresia at St. Damien Hospital, our title could be Exploring Prognostic Indicators in a Duodenal and Intestinal Atresia Surgical Cohort in Haiti. And you can see that we use 2 to 3 of the keywords that we've already designated in the prior slides. Once you have your title and your keywords, the next thing you want to do is develop the background or introduction for your research protocol. In general, this is a couple of paragraphs that state the motivation for your work, include the relevant literature on what's been done before related to your research question, and describe your hypothesis-specific aims and objectives. In terms of what you shouldn't do during the introduction is you shouldn't state your opinions. You want to clearly stick to what's been done in the literature, and you don't want to include any results. So this is clearly just focused on what's been done before and what makes your study unique in your specific aims and objectives. When we look back to our example on exploring prognostic indicators in a duodenal and intestinal atresia cohort in Haiti, our first paragraph, we really want to start broad. Then in the second paragraph, you can narrow to your region or topic. And in the third paragraph, you can say, why is your research new, important, or relevant? So in our first paragraph with this example, we would look at the impact of pediatric congenital anomalies worldwide, including sentences on how many children are estimated to be affected by these and what the overall mortality is in other countries. Then you can narrow to your region or topic. So for this example, we would say, what do we know about pediatric congenital anomalies in Haiti? And the answer is that we don't know a whole lot, which is why this research is new, important, or relevant. So then you could go on to explain that this would be the first study to explore outcomes for this patient population performed in Haiti. Once you have your background and introduction written, if you write it very well, you can use it for the IRB proposal, and you could also use it for the beginnings of an introduction for your paper. So it's very important to dedicate the time to review the literature and really write that introduction well for your research protocol, because it can be used in other parts of this course. Then you want to describe what methods you're going to use to perform your study. In general, when you write about the methods in your research protocol, you should include the study location, where the study is going to occur, how long the study is going to occur, so the time frame, what population you're planning on studying, the time frame for data collection, so not just when the study starts and when you're going to analyze the data, but when you're actually going to collect the data itself, and what your data analysis plan is. When we think about a data analysis plan, this is not going to be something that's a reaction to the data that's already collected. You want to clearly outline what you plan to analyze before you start your study. And so it should be pre-planned. You don't just want to collect a lot of data and then go back and figure out how you can compare different things. So you want to analyze your data based on the hypothesis you are trying to test, the population you plan to study, and the types of data you plan to collect. When we look at an example of what the methods section will include, again, using our example of exploring prognostic indicators in a duodenal and intestinal atresia cohort in Haiti, we define our specific study area as Port-au-Prince, Haiti. We define our specific timeframe from 2015 to 2019. We define our study population as all patients who underwent surgical intervention for duodenal or intestinal atresia. And when we think about the method of data collection, we are going to use a retrospective method for this example. We plan to collect data on whether or not patients received a preoperative ultrasound, what their home address was, their gestational age, their birth weight, what operation they had, and whether or not they died within 30 days postoperatively. When we look at our analysis plan, we're going to compare operative outcomes for patients with and without a prenatal diagnosis using a chi-square analysis, compare operative outcomes for patients living outside a 2-hour access zone with a chi-square analysis. And then when we think about ethical considerations, we want to include how data will be collected, protected, and managed by study participants. When we really focus in on the types of data in your analysis plan, the type of data or variable matters because it will determine what type of statistical analysis you will perform. The type of data can be categorical, and will represent a proportion or percentage, or it can be numeric variables, and you can look at the mean, median, and modes and compare them across groups. For categorical variables, we often use a chi-square and other statistical analyses. And for numeric variables, one example of a test we can use is the t-test. Now, don't get too caught up in this yet. We'll discuss this more in the data analysis lectures, where we'll discuss a number of different statistical tests and how to plan your analysis. When we talk about types of variables, again, we're just going to briefly introduce them here, but we'll cover this topic again and again throughout this module. We typically think of variables in two categories, categorical and numerical. In the categorical variable section, there are nominal and ordinal variables. And in the numerical section, there are discrete and continuous variables. When we think about categorical variables, an example of a nominal variable would be whether someone is male or female. When we think of ordinal, these are typically ones that are assigned into different categories, but have an order that's usually given to them. So mild, moderate, and severe pain, with mild being the least and severe being the worst type of pain that someone can have. When we think about numerical variables, we have discrete. So this is something that stops. You have the number of cases, it's 1 or 2, and it's the number of people. So 1 or 2, you can't have 1.25 or 1.33 people. This is a very clear discrete number. Or you can have continuous numerical variables like height and weight. So you can be 56.5 centimeters tall, and you can weigh 3.982 kilograms. So this is an example of a continuous numerical variable. That was just a brief introduction on the different types of data and variables that you can include in your analysis plan. And your analysis plan will typically include descriptive analysis. So you describe what patient populations you're studying, and typically you'll put all of that information like age, gender, average weight, and types of procedures in what's called a table 1, where people can clearly see the 2 different populations compared or studied in your research plan. And then your analysis plan will also include what statistical analysis you plan to do, but you won't have to come up with that yet. We'll work on developing that as groups in our mentorship teams after you've had some of the statistical lectures that are to follow in this module. Finally, when you're designing a research protocol, you have to think about ethical considerations. So there'll be a number of things to include in your protocol to cover patient privacy, the risks to the patients, and confidentiality. So an example of what you might include in the ethical section of your research protocol is that you're only going to record patients' medical record numbers, which will protect patient privacy because you're not recording their names or their addresses. So if someone were to get a hold of your data, they wouldn't be able to identify the patient. You may include what the risks are to the patients, whether there are emotional or physical risks during the study that participants might encounter. And you may include whether or not patients will be able to be identified from the study itself once you publish it. Finally, when you think about a research protocol, it's nice to stay organized and give your reviewers and your team a good outline of how things are going to progress over a time period. One of the ways that you can do this is by developing a Gantt chart. So you can see here, this is a Gantt chart that could be used for this course where we've done the literature review and you've developed your questions into April. And now over the next 2 months, your goal is to write the research proposal, hoping to have it done by the end of May. In June, we'll work on obtaining IRB approval at your designated institutions, so ACHU-EH, LaPi, and ACHU-J. And we'll try to get that by July, and we'll collect data from August to October and analyze it October, November, December. And as we're analyzing the data and collecting it, we'll begin drafting of the abstracts and the papers, hoping to finish those by the latest of February 2021. And we'll work on developing these Gantt charts, and we're writing the background and introduction with our mentorship teams this week. So in summary, we've discussed the key components of a research protocol, described key components of research protocol methodology, and seen how to construct a Gantt chart. We will provide an example of a research protocol on Canvas, and we'll work together with our mentorship teams to write the background and introduction for our research protocol in the next week. Thank you so much, and we look forward to working with you on office hours.